people join in here for a second. So, what's your favorite season?
I mean, I would say probably, it probably is, or maybe I would say late spring.
Yeah,
it's probably my favorite season, just because I like it when it warms up, and I like hanging around the pool. And,
yeah, that's the best time of the year. Best time of the year. Well, happy first day of summer, everyone. I'm here with Dr. Monty Trimble with Dallas Breathe 3. Appreciate you taking some time out of your busy day here on the first day of summer. Beats the heck out of doing this outdoors, right?
Yeah, that sure does.
So again, this I'm meteorologist Dan Brunoff, in case you didn't know, and again, Dr. Monty Trimble here with Dallas Breathe 3.
Hello.
And God, when was it? I think it was last November. I had balloon sinuplasty, and I had a deviated septum as well. So I had like the dual problems with my nose. I've been dealing with a deviated septum, sinus infections for decades. Lived in Abilene, Texas for 5 years, and I swear to you, I got 3-4 sinus infections a year out there, and it was just grueling. And then factor in the ragweed and the mountain cedar season. You got the mold spores. We're having air quality alert in effect for today,
and that's for sure.
Yeah, we live in a state that we have lots of different types of horticulture, lots of different trees and bushes and flowers and weeds. So it gets pretty rough around here sometimes. And you changed my life, Dallas Breathe 3 and yourself.
I appreciate that.
You really did. And
I can take all the credit, but thank you for that.
It was amazing. And so let's first tell everyone a little bit about yourself, where you're from, how long you've been in this industry.
Well, I grew up in Texas. I was born in Odessa, so I grew up in the Permian Basin. Then I went down to College Station and got a good undergrad education. Detoured through Houston for a couple of years, ended up in San Antonio for med school, then Missouri for residency training, and then I always wanted to come back to Texas to practice, and so ended up here in Fort Worth in 2002.
Okay.
And so obviously, practiced general ENT, but I think even in, my residency training, I always, tended to enjoy rhinology, or the practice of treating sinus disease, probably, more than the other aspects of ENT. So as time has gone on, my practice is kind of narrowed down to treating really only, sinus and nasal issues. And that tends to be what I tend to be most passionate about. So it seems like a good area to practice in for that, with all the issues that we have here.
Now, this again, Texas, it's so big, and we have so much flora out there, and what problems arise when of course, allergies are big. What health reasons should you get balloon sinuplasty? Why should you get this treated, especially if you have chronic sinusitis like I did? I remember you saying I was one of the worst cases that you've seen in somebody, and I'm proud to say that, because you changed everything about me. So why balloon sinuplasty? Why should people get checked out to see how severe it is, and what changes can be made in their life?
Yeah. I mean, one thing I would, maybe I would back up and say is that one thing that makes, I think, the Dallas-Fort Worth Metroplex unique is the level of pollution, or as we might call non-allergic irritants. And so I think sometimes, people move here and they think about the allergens, as you mentioned, the tree pollen, the grass pollen, the weeds, but they forget that pollution potentiates the nose for being susceptible to allergens. It breaks down the normal protective, layers, in the nasal cavity, and then as that inflammatory process continues, sometimes with the addition of sinus infections or viral infections, and people develop chronic rhinosinusitis over time. If you're getting, recurrent sinus infections, those people usually know, hey, I have an issue.
Right.
The issue is those that never get those. Instead, what happens over time, they develop this inflammatory process called chronic rhinosinusitis, where they just don't feel as good as they used to. Maybe they wake up tired, maybe they're dragging. I see patients all the time that tend to blame that on, having kids. They blame it on age. They blame it on all sorts of things, other than the fact they're just simply not getting, the quality of sleep that they used to, because when they lay down at night and they go to sleep, they're simply not breathing through their nose as well as they used to. So, the whole goal of treatment here is to create more room for better airflow. So, if your sinuses are plugged up, if you've got inflammation within the sinuses, being able to enlarge those openings with a tool such as a balloon is a great way to improve the function of those sinuses. And then, of course, there's also procedures we can do, such as you had a septoplasty to improve the airflow through your nose. But I always tell people that, none of this treatment can happen in a vacuum. And so obviously good topical therapy with intranasal steroids over time seems to be the one thing that we also try to encourage people to do so that their nose is healthier over time.
Right. So like Flonase, like these
over
the counter,
Nasacort, yeah.
Right. The over the counter, like just plain nasal spray is bad, right?
Yes, decongestant sprays such as Afrin are bad. Other than like an emergency situation, maybe using a day or two here or there. But we do see a lot of patients who've been on, Afrin or something similar sometimes, for months to years, and they become, addicted to that. And the problem with that, even though it obviously gives you some temporary benefit, those medications, are basically an irritant to the lining of the nose, and they just compound the issues that people get from living in a bad environment such as the one we have, out here.
Wow. So getting started, and out there how bad your situation is. I mean, I can breathe through my nose, and it's crazy. Even for the first time in my life, I'm sleeping just about through the night. Okay?
Which is always good, especially at your age.
Wow, it's crazy. And my mind doesn't wander. I have a deal with, I'll lay on my pillow. I'm a side sleeper, so I'll lay on my pillow. I'll do my thinking for 5 minutes, right? Because we all do it, and we all think about what we got to do the next day. And then I trade myself. As soon as I flip over to the other side, and it's easier said than done, I shut my brain off, okay? And that's just kind of how then, so I'm asleep. And since the surgery, I mean, I'm asleep. I may wake up every now and then, bad dream or something. But I'm sleeping through the night. Do you think that the sleep apnea, because I had that, I actually had somebody videotape me. I had her videotape me while I was sleeping. And she said one time it was like 14 seconds that I stopped breathing.
Yeah, and that's not even technically a long time.
No, and well, to me it was. I had no idea. But does that have to do with the chronic sinusitis, sleep apnea, and does balloon sinuplasty help clear that up? Because I'm sleeping better. I'm not waking up a lot, and I think maybe that's why I was not breathing.
So, I mean, I think it makes sense logically that, as your nose becomes more stopped up, particularly during your sleep, you're going to have to work harder to breathe through your nose. And at some point, your body's going to compensate by opening the mouth, and then you're going to develop some dysfunctional breathing habits over time, which may be partial obstructions, total obstructions, and then we know at some point that becomes habitual. And so if you look at why sometimes people have their nasal obstruction, their sinus issues addressed, and they may continue to have obstructive sleep apnea, it's because there's a habitual component that's developed over time. This is why I tell patients all the time, it is so important not to ignore those issues, but to get them treated proactively, because once you develop obstructive sleep apnea, it's a lot harder to address or reverse than preventing it from developing it in the first place. And if I look at patients who come in and, maybe they're waking up tired, maybe they're snoring, maybe they're having some obstructive episodes, but they haven't been doing it for a long time, I would say, almost all of those cases, if not all of those cases, patients go back to normal once their nasal issue has been resolved. The problem with human nature, and I have that issue myself, particularly being a guy, is that I want to put things off and I want to ignore them because, look, I mean, I don't know what I'm going to get when I go to the doctor, more than anyone else. So we're always concerned that, what if I go and I get talked into doing something I don't want to? What if I have a bad experience? What if it doesn't work? And do I really need to, to have that done? But, as someone who's done this for a long time, I would say that, look, patients come in here for a lot of different reasons, but it seems like the source of so many of those problems is what's going on in here in their nose. And once that nose heals, I mean, the success rate is, 90 something plus %. I mean, if not higher in patients that are at least doing better, Obviously we live in an adverse environment. If you don't continue to take care of your nose, kind of going back to the intranasal steroid, these problems, to a certain extent can come back over time. But I tell you, quality of life issues from chronic rhinosinusitis are typically much worse than what people realize, particularly those who don't have sinus problems. They don't really understand what everyone else, such as yourself, are suffering.
Sure, makes sense. I always do this halfway through, make sure it's still recording. Okay, good.
Always a good thing.
Yeah. Okay, so balloon sinuplasty.
Yes.
What is it?
Well, so I mean, as I tell people, look, I think if you look at the progression of treatment of sinuses over time, it's become less invasive. It's become hopefully more directed towards what the actual issues are than doing unnecessary work in the nose just because, we thought somehow that would be helpful. And so, if you think about of what's going on in the sinuses, inflammation and narrowing within the opening of the sinuses is tend to what, contributes to getting recurrent sinus infections, chronic inflammation in the sinuses. So instead of going in and actually, cutting tissue out of the opening, or maybe making an opening that's larger than necessary, instead you're just sticking a balloon, which is very similar to the type of device you might use in a cardiac catheterization where you're dilating vessels and stuff. And so you're basically just enlarging the opening into the sinuses, which creates more room for drainage, also airflow, and so it does that in a minimally invasive way. Of course, I tell people, look, when patients come in here, we're not just simply offering them a treatment device or some type of maybe single option. I always tell patients, I always look at their CAT scans. We look at their at their what's going on inside of their nose, and the goal is to do the least amount of treatment to get the result that they need. So if there's other things going on, obviously we want to address those at the same time. I've removed tumors in the office. We've removed polyps. Obviously we fix deviated septums when that is necessary. But the goal is not to address things that don't need to be addressed.
Right.
Because remember, the nose is a filter. It's a very functional part of the body. And the last thing we want to do is to go in there and remove parts that do not need to be removed. So the balloon gives us a mechanism to improve people with the least amount removal of tissue or other things that might not be necessary.
Okay. So first step, come in, we'll give you a call. The website, Dallas.
Yes, DallasBreathe3.
Right.
.com, yes.
It's real simple, DallasBreathe3.com. You go there, you give them a call, you make an appointment. So they come in for their first appointment.
They can even make an appointment online if they want.
Well, online too, yeah. So DallasBreathe3.com. What do they make the appointment, they come in, what do you do the first time you see them?
Well, they come in, they get scanned, then my PA will sit down with them and go over their scan, scope their nose, talk to them about, obviously, the type of issues they're having, and then, from that information, come up with a treatment plan and see maybe what we can do to help them.
Right. And then they come in, they make an appointment, surgery. How long does a typical surgery last?
I mean,
and it's a day surgery, right?
Yeah.
Anesthesia or pills or a choice?
I mean, we give people a choice. I will say that, once we started doing IV anesthesia in the office, we've been doing office procedures with balloon sinuplasty since 2011. So I tell people, when we first started, a lot of people were very, very much wanted to do a procedure in the office, fully awake, as long as we numb things up. It seems like over the last few years, more people would rather not know what's happening.
And that's what I had. I had the anesthesia.
Yeah, and so, it's one of those things where, most people, do choose the anesthesia, and we use propofol, and so, I think a lot of people are familiar with that. That's what you get when you go in for, colonoscopy, your esophagoscopy or whatever. And so, obviously, as far as the length of the procedure, if someone really very much is a straight, balloon sinuplasty case, maybe a little turbinate reduction, it might take them, 30, 45 minutes. There's sometimes complicated cases that can take, 2 hours, just depending on what it is. And so, I tell people, I don't want people, to think, hey, I think my problem is maybe too big for what, we can offer, what we can address. And I want to tell people, I think we're very good and very comfortable at addressing whatever nasal issues you may have as far as what's going on with your sinuses. And so the key there is we really do try to tailor the treatment to the patient. And that's why I said I don't think that any two treatments are ever exactly identical. So we definitely want to make sure that we're addressing you and not just giving you a procedure hoping that it will work for you.
Right.
That kind of makes sense.
Well, the one thing that sticks in my mind, of course, is how I feel today, right? I can taste my food better, I can sleep better, I can breathe better. Overall, physical health seems much better as well. But I remember, and you do as well, the old shows, the black and white shows, that finally went into color. Father Knows
yeah.
Best, Dick Van Dyke, all the old family shows that came out back then, and even before that, and the Waltons, Little House on the Prairie, and little Johnny was sick or whatever, and so the knock at the door, and there's a doctor with a little case, with all his little stethoscope and whatever he needed to treat patients, and house calls, right?
Right.
Then the word bedside manner came around, right? And that kind of stuck around for, the 70s, I remember, and then probably into some early 80s and stuff. The doctor has the best bedside manner. This guy right here, and I love all the doctors I've seen out there, and you're all wonderful. I'll just do a top two. I mean, you're the top.
Oh,
I mean, seriously, and I'm not just blowing smoke, but this guy, we will talk even after the surgery's done, or if I'm in for a procedure, there'll be a knock at the door. Doc, you got another patient. He's very informative. He knows what he's doing. That's the best thing about it all, and makes you feel comfortable, and just a good all around guy, and Texas guy too, Midland, Odessa out there. And I'm sure you're probably got some problems initially. You don't do surgery on yourself, but with all the dust out in the Permian Basin. So I wanted to compliment you on that. And that's a big deal when and all of you probably are the same way, when you go out and you're interviewing doctors and you're getting pricing, or you want to know how long they've been doing something, and they're not trying to, sell you a BMW when you don't need a BMW. This guy right here is somebody that I trust with my life, and he definitely changed my life. So thank you for that. So free plug for you, which is an honest from the heart opinion there. Lastly, it wasn't painful. I mean, you put me under anesthesia. I was in and out. I had to get a ride home and a ride there, of course. My brother picked me up, took me home. Very important, okay? This is very important, and I know you'll back me up on this. Post-op stuff. You got to keep up with what you need to do to get things to heal properly and more efficiently. And what are those things that you have to do? Follow the directions of the sheet you give you, right?
Yeah, I mean,
so nasal rinses, make sure you do all your meds.
So I tell everyone, I'm like, look, you just had something done. So on the day of your procedure, go home and take a nice nap. If you take a 6 to 8 hour nap, a little cool rag, maybe an elevated position, that really sets the stage as far as healing. And then during the week, we're having you do some medicated rinses, twice a day for a couple of weeks. The reason for all of this is we're trying to protect what's going on in here from what is, a fairly adverse environment in this area that tends to get worse from year to year. And so we find that patients that, follow those instructions do very well. I do tell people, when it comes to pain, I mean, unfortunately, if you're someone who's coming in because you're having tons of headaches and facial pain or pressure, obviously, what we're doing sometimes will temporarily aggravate that. But for patients who come in and, they're not having headaches, they're not having those issues, it's just a breathing issue. Those patients usually are doing pretty well, usually in a day or two if they've just had balloon sinuplasty. But even if it's a septum, usually those patients do pretty well after, I would say about 5 days, if not a little bit less. And so, like I said, there's always exceptions, but in general, with doing it this way, people have done very well. And one thing I was going to add in there for, those patients that, are having a lot of, ear complaints, everything, from ringing to pain issues to other problems that they're not really attributing to maybe their sinuses or to even, sleep quality issues. I'm always amazed at how many of those problems, as well as even throat issues, tend to be related to what's going on at night, and people sleep and they're just unaware of those things. So, we see a lot of patients who have, kind of done the circuit of, going different places trying to find an answer. But I always tell people, look, I said, we know that breathing is very important. If what's happening here, particularly at nighttime, is not going well, you're going to have a lot of issues that are going to pop up. And usually it's not the nose that people are thinking of first, unfortunately.
Yeah, exactly. So I was back, well, of course, I was working at home at the time, so I was back on the air. I think I had it done on a Friday on purpose. Okay. That way, I don't want to get you built up just on Fridays, but I did that personally because, I talk for a living, I'm working from home. I didn't have anyone really to take care of me this time. And so that gave me the weekend to kind of chill, I married Netflix, by the way, about a year and a half ago, so I forgot to tell you I got married.
Oh my gosh.
So, because of COVID. So I binge watching shows. I followed the post-op directions to a T, okay? And that's highly recommended. A lot of people think, I feel better. No, you got to keep doing it. And if you want to know any tricks and some things I did, you can private message me as well. Some things that made it a little easier on me as well. And again, it's life changing. And I highly recommend balloon sinuplasty with Dallas Breathe Free. Dr. Monty Trimble is a god and very good at what he does, and he's been doing it for a long, long time. Locations, you do the surgeries here in
so we have a Fort Worth office, and then we have a Dallas office, which is in right across from the Four Seasons in Las Colinas.
Okay. Do you perform surgeries there as well?
Yes.
Okay,
Yeah.
so you got 2 locations,
Yes,
and you can go to Dallas Breathe Free and find out where he's at compared to where you live to be able to schedule those to make it more convenient for you to get to and from the surgery. So thank you.
All right.
I
Thank you.
appreciate your time.
Appreciate it. No.
And again, DallasBreatheFree.com. It's life changing. Dr. Monty Trimble. And again, I hope everyone has a great first day of summer. If you have any questions at all, private message me and I'll answer those for you. And be sure to tell them, and I would appreciate this, that Dan the Weatherman, that's me, sent you when you do make an initial consultation. Again, there's no obligation when you come in, but you'll get to find out a little bit more. And I'm looking at one of the scans right now on your large computer screen here. Really interesting to see what's going on up here. We think we know, but until you see it,
Yeah, that is very true.
that's very, very life changing. So, all right, I'm going to go ahead and log off here. Appreciate your time.
All right. Thanks, Dan. I appreciate it, especially all the nice things you've said.
Oh, you bet, man.